How should you taper off NF4 acid reflux? Are you wondering how to safely reduce your use of proton pump inhibitors for acid reflux? You're not alone. Many people face this challenge. Tapering off these medications requires a careful approach to avoid worsening symptoms. First, it is important to understand that stopping proton pump inhibitors suddenly can lead to rebound acid hypersecretion. This means your body may produce more acid than before, making your symptoms worse. To prevent this, a gradual reduction in dosage is recommended. A common method is to cut your dose in half every 1 to 2 weeks. For example, if you are taking a daily dose, you might switch to every other day, then every third day. This stepwise approach helps your body adjust. During this tapering period, you can consider adding a histamine to receptor antagonist. Medications like ranitidine or famotidine can help control acid production and lessen rebound symptoms. Antacids or medications containing alginate can also be used as needed for breakthrough symptoms. Typically, tapering off proton pump inhibitors takes about 2 to 4 weeks. However, some individuals may need a longer period, depending on how their body responds. After stopping the medication, some people may still need to use histamine to receptor antagonists occasionally to manage any remaining reflux symptoms. Monitoring your symptoms is vital throughout this process. Regular follow-ups with your healthcare provider are important. You should check in at 4 to 12 weeks after tapering and even up to 6 to 12 months later to see if symptoms return or if there are any complications. If you have been on proton pump inhibitors for more than 6 months without a clear ongoing need, and you have been symptom-free for at least 3 months, you may be a good candidate for tapering. However, if you have severe esophagitis, Barrett's esophagus, or a history of bleeding ulcers, it is essential to consult a specialist before making any changes. Doctors should regularly evaluate the need for continued proton pump inhibitor therapy. Discussing the tapering plan with your healthcare provider is crucial. In some cases, diagnostic procedures like endoscopy may be necessary if symptoms persist after tapering. The goal is to minimize long-term use of proton pump inhibitors while effectively managing acid reflux symptoms. This can be achieved through a combination of adjusting medications and making lifestyle changes.